Joining us now for some response to what we heard at this incredible presidential town hall last night, House Speaker Nancy Pelosi of California. And I guess we'll start there with this apparent plan that the president says he has that would replace Obamacare. Have you heard anything about it?
No, as you know, the Republicans have always said repeal and replace. All they want to do was repeal because they really do not have a commitment to governance, a public role in health care. So many of their supporters say, government, keep your hands off my Medicare. Well, what do you think that is? But anyway, I thank you for presenting that this morning because this is a very important health issue. It's not just about the preconditioned benefit. That is essential. But accompanying that in the Affordable Care Act is the removal of the caps on lifetime or annual limits. So if you keep the cap on that, then people are protected from extravagant cost. On the other hand, if you let that cap go, you're at the mercy of the insurance companies. And I think that's what the president has in mind. Has in mind is a sort of a casual phrase. I don't know what he has in mind. But let me just say, we're supposed to be crushing the virus right now. Crushing the virus so that we can open up our economy, open up our schools safely. Instead, the president is crushing the Affordable Care Act. He's crushing it in his misrepresentations. He's in the court of public opinion, in the Supreme Court of the United States, as George Stephanopoulos so aptly pointed out. This is very dangerous to not only the health of the American people, but the financial security of America's families. Their kitchen table issues center around health care, health care, health care. Its costs have a direct relationship to their economic well-being.
That was a stunning lie from the president right to the face of that voter. In fact, the Trump administration filed at the U.S. Supreme Court 3 months ago to completely dismantle Obamacare, quite the opposite of what he said. Speaker Pelosi, good morning. It's good to have you on. I want to ask you about some legislation that's sitting in Congress right now. I know there are frontline members of your own caucus who are now saying, Speaker Pelosi, we got to get something done here. We understand that you don't want to give in to Mitch McConnell. You don't want to give in to Republicans and come down from your number of $2.2 trillion. But for the sake of the voters in our district, for the sake of our citizens, we've got to get some relief in their pockets. So what do you say to that balance between not giving in to Republicans, but also having to get something done for the people you represent?
Well, I appreciate your question, and welcome to my world. I have a beautifully diverse caucus. There are some who want me to put the HEROES Act, $3.4 trillion, back on the floor because it is very well developed. It is science-based, academically based, institutionally based as to why we need that money. We did come down. We came down $1 trillion, asked them to come up $1 trillion so we can come closer in a negotiation. They didn't do that. Then we said, we'll come further. Leader Schumer and I said, we'll come closer. We'll meet you halfway. So we have come down. But the needs of the American people, we can only go so far. We cannot have a Sophie's choice of feeding some children and not others, housing some people and not others, meeting addressing the disparity and the assault that the virus is making on communities of color. So we have come down. So we have a number of schools of thought. Those who want us to put 3.4 back on the floor, then come down in a negotiation from there. Those who say just put something on the floor. But what we want is to put something on the floor that will become law. And so that requires a negotiation. And until they come to the table serious about 14 million children are food insecure in our country. They don't have one penny for that in their bill. Their families, millions of their families on the verge of eviction. They don't have one penny of that in their bill. These are all corona-centric expenses that we have. But the most, again, the HEROES Act is about our state and local, and they are coming at that with a vengeance. With a vengeance. They're coming at it with a vengeance. We don't want to help these blue states. Really? This is the United States of America. They have a vengeance against the state and local. They have contempt for science by not doing the testing, tracing, treatment, mask wearing, isolation, sanitation that science tells us. The scientists on your program, academics over and over again, this is what we need to contain this virus. So I'm used to building consensus in my own caucus. I'm proud of every statement that members are making, and I'm especially proud of our chairs who have been solid in terms of what we need, where we could perhaps change the timing so it's less money now. That's how we were able to come down. We didn't cut things out. We just brought it down. But it's important to note this. That was 4 months ago, May 15th. Yep. This has accelerated since then. We have additional needs for restaurants, airlines, and the rest, and those things have to be taken into consideration as well. So in order to stay with meeting them halfway, we'll have to make further cuts. But that's about negotiation. We can put a bill on the floor, but we want to put a bill on the floor that will become law.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.